I'm from San Diego originally. I'm 45 years old, and I have a huge family, 5 kids. We live in La Mesa, which is about 20 miles from the water, from the coast. And I was riding my bike at least 2 or 3 times a week to the coast and back home. And I can no longer do that. I can no longer ride around the block, let alone to the beach.
I used to snow ski quite a bit. I used to body surf. I used to run half marathons 3 times a year. Oftentimes they think that I'm blind because I have this harness on this dog, so they think he's a guide dog and not a service dog.
I have a 2.5-year-old little girl and a husband who's in the Navy. I stay at home with my little girl and we live a very hectic life. And I'm also expecting, pregnant.
I was born and raised in San Diego. I'm a mother of a 14-year-old boy who's very active in baseball. You know, they automatically say, but you look so good, or but you don't look sick. And while that's a compliment, I sometimes, you can't help but take it as, well, I wish you knew how I felt inside. You don't know what I go through on a daily basis. I sometimes wish I looked like I felt.
I also used to love to sail, but sailing, beyond just day sailing, is dangerous for someone in my condition to go out on a sailboat and sail offshore, for example. We can go along and sit in the cockpit and we look perfectly happy. And I am perfectly happy, but I'm of no value to the captain of the vessel. And that kind of bothers me. So this is not what I perceive retirement to be.
Hi everybody, I'm Dr. David Granite, and welcome to Health Matters. Today we'll be talking about multiple sclerosis, known commonly as MS. Approximately 400,000 people in the United States acknowledge having MS, and approximately 200 cases a week are diagnosed. This requires an expert, and today we have one with us, Dr. Jody Corey-Bloom, a professor in neurosciences at the University of California, San Diego. Welcome.
Thank you.
Now, I thought that was so funny that it said acknowledge having MS. And I think that's going to be a thread that runs through our discussions about what really is MS when people want to admit they have it or not.
Yeah, I mean, exactly, David. It's really a problem. I think that it's one of those diseases that strikes young people. It strikes them really when they're trying to be productive, when they're working. And so it oftentimes is very difficult for them to acknowledge that they may actually have a neurologic disease.
All right, so let's debunk and educate a little bit. What is multiple sclerosis?
So MS is a neurologic disease, and it's a neurologic disease that affects the central nervous system and the spinal cord. So it doesn't affect nerves, it doesn't affect muscles, but it definitely does affect the control centers of the nervous system, the brain itself, the brainstem, and the spinal cord. And what happens in MS is that myelin breaks down. Now, myelin is a fatty sheath, a covering, if you will, that protects the axons or the nerve cables for each of the nerve cells in the brain. I like to think of it like insulation, really, insulation for wiring.
Sure.
And so what it does is keep the signals on track. So one nerve cell trying to talk to another nerve cell, it keeps those signals on track. In MS, that fatty sheath, that myelin, is actually attacked by the person's own immune system, and so it breaks down. We form plaques, actually, in the brain, in the brainstem, and in the spinal cord. And as a result, people's conduction, or the sending of messages from one nerve cell to the next, is interrupted.
Neurological diseases are odd in the sense that, I mean, we may be able to move our muscles, but we can't communicate with them. What our brain is trying to tell our muscles is not going through the little motions of getting there.
Is there a genetic component to this in terms of the susceptibility?
Yeah, there's, to some degree, it's not a genetic disease. We shouldn't think about it as an autosomal dominant disease, for example. It's not a disease in which if a parent has it, a child is definitely going to have it.
What else?
Well, that's where we've kind of fallen down a little bit. We don't really know what else. We do know that it seems to occur in women more than in men. Probably 2/3 at least of patients are women. We also know that it tends to occur in young women and in young people in general. So, you know, it's actually much more likely to hit people in their 20s to 50s.
My early symptoms were optic neuritis. Back when I was 12 years old, I lost the vision in my left eye. It wasn't until I was 24 years old that they did an MRI to determine that it was indeed multiple sclerosis.
My walking, I wasn't tracking straight when I would walk. We went out to eat. My mom thought I'd had too much to drink and I only had a beer at dinner. So then I noticed when I was working, my eye was kind of twitching. It was a little bit different. And then the other thing that was most noticeable was bladder. You have what they call old brain, new brain. And people with MS, the new brain is really affected and the short-term memory is really affected, and you do a lot of word searching, and it gets really frustrating.
A difficult part about having MS is that it's so invisible sometimes, that people expect you to look and act a certain way when you're sick with a disability, when a lot of times the symptoms that I have are invisible indeed, are not seen just by looking at me. You can't tell that I can't see out of my left eye. You can't see that I have an implant in order to empty my bladder regularly. A lot of things that people just don't understand by looking at me.
So we have a person who may live in an area where there's a higher risk, maybe has a family member that had some problem along these lines. It's generally in what we would consider the prime of life for health, between 20 and 50, before we expect most things to start happening, and they start to get some of the symptoms that you discussed. So they're getting a little bit nervous, right? The next step then is going to be, how do we make a diagnosis?
Yes, and the diagnostic process itself really requires that people have neuroimaging, brain MRIs, sometimes MRIs of different parts of their spine. Sometimes we have to do a lumbar puncture or a spinal tap, which most people are actually very concerned about or very nervous about, as you might imagine. Believe it or not, the diagnosis itself is actually still a clinical diagnosis. We have tests that can actually show lesions that look like they might be demyelinating, but sometimes it's not, those lesions are not specific.
All right. At what point do you have enough information?
Going back to that woman that we talked about, the woman presents with optic neuritis when she's 25. 3 or 4 years later, she develops numbness and tingling of one side of her body. We examine her neurologically and find that there actually is numbness and actually maybe a little weakness that she wasn't even aware of. So that would be 2 episodes of neurologic problems. We get that brain MRI. We see white matter lesions that are not just nonspecific. They're actually located in the areas of the brain where MS lesions are most likely to occur. They're oriented as MS lesions are. We may get that spinal tap and find that there are oligoclonal bands in that. Oligoclonal bands and increased IgG synthesis are usually 2 hallmarks in that spinal fluid of MS, so we use that. And then, I think it's putting it all together at that point in time. The age of the patient, the kinds of episodes they had, the appropriate white matter lesions, and the findings on spinal fluid. I think most neurologists would be comfortable at that point saying, yes, I think this definitely is MS, and actually that patient would meet clinical criteria for the diagnosis.
Initially, when Mark was diagnosed with MS, it kind of was like a slap in the face. We went to see the neurologist and basically sat us down and he said, you have MS, here's some pamphlets on it and we'll see you in a year.
I worry about my son, being 14 years old. He probably worries a little too much about me than a 14-year-old should, but I think it's a good quality that he has. He's very compassionate and caring and loving, and that's what I would want in a son, and I luckily got that.
As a guy, there's not been really anything difficult. I've just dealt with it and stuff. I would say for the most difficult part would be on my 5 kids and my wife. The poor kids having to deal with me, seeing me running around, you know, maybe being their soccer coach, and now I'm the guy sitting on the sideline, no soccer coach. So that's probably been the hardest, dealing with the kids. That's another unfortunate part of this disease is now I'm disabled. I missed her mom. My wife works, whereas before she was staying at home with the kids, and I was working like 20 hours a day, and now I'm staying home with the kids. I missed her mom.
In the beginning, I would say for the first couple of years, it was just kind of an identity crisis. Does this mean I'm going to be bedridden now or confined to a wheelchair? Like, what does this mean for me? And yeah, I'm really sick and I have this awful disease, yet I feel pretty good. And, you know, it was just a major identity thing, because it was also realizing that I now have a disease and I'm never without that disease. Like, I can never just wake up today and say, okay, today I'm not going to have MS. Like, it's with me every day.
The most difficult part is how total it is. It affects everything that I do, whether it's something very simple, like getting dressed in the morning or taking a shower. I'm unable to balance myself, or I'm unable to move myself to wherever I need to be. It's so pervasive. Everything you do, the most simple task, is complicated because of MS, or at least at this point.
You know, when I went to medical school, if you were diagnosed with MS, people would say things, doctors would say things like, well, go get a wheelchair, you know, kind of a thing. I mean, horrible. And I think that that's not what we're about today. That's not what we're talking about. I'm pretty emphatic about that. I feel very strongly about it, because I think for the first time, we really have treatments, and treatments that work. And I think it's really important to get on treatment early, and to actually be aggressive, you know, about the disease. I like to tell people that many of my patients are still working. I like to tell people that I have actually a triathlete as a patient. I like to tell people that I actually have a surgeon as a patient, because I think that this is really the message I want to give, that in fact it's really possible to go on with your lives, and that I think right at that moment, right at the moment of diagnosis, everything feels awful.
You just become the master of adjusting everything. You have to, in order to, you know, to make your life, your quality of life good, you have to do things differently. There's kind of a pre-MS way that you did things, and there's a post, which after MS.
MS doesn't have me, and I don't think MS has our family, because we still play softball, we still play soccer, we're very involved in all sports, and Mark was a football player. All of our family nephews have scholarships, and so the children keep going, and Mark attends as much as he can.
You've got to be really smart when you have MS, because your energy is very limited, so you don't want to waste it. I have a scooter. When I get the mail, I use my scooter if I take out the trash. I only mainly use the Walking with Reed for short distances, like going to my car. I take him to church, and I put on his harness, and we go.
I have these trek poles, and primarily these were used for like if you're hiking or walking in the snow or whatever, and it's a great thing for me, for balance. Trek poles.
Feel free to ask. I wish more people would ask me what the situation is, because that is positive. That's recovery for me. If I can talk about what's happening, that's beneficial to me as a person.
It was very difficult for me to consider starting a family. That was one of my most major concerns upon diagnosis. I always knew that I wanted a family of multiple children, and that was one thing that I really wanted to clarify with my neurologist, is this something I'll be able to do? And even she wasn't able to give me a direct answer at the time, because again, no two cases of MS are alike, so how was she to know what my course of disease would be as opposed to any of her other patients? So she couldn't answer my questions when I would ask her, can I have children? Like, it was just kind of more like, you have to see how you feel. And that wasn't enough for me to say, oh. But then I realized after a while I feel pretty good. Like, why wouldn't I have children? This has always been my life's goal and my life's plan. Why does that have to change now?
I think having a good doctor who has helped get them through all this is incredibly comforting. And I think being in a place where they know they have an expert, where they're getting good treatment, allows them to have that peace of mind that they're in the right place and that things are going well.
I think that's true. I hope that's true.
I know it's true, so there's no doubt about that. The patient who comes in uneducated, you educate them, they get educated about themselves. You talked about working, and is there a support group for people so that they can talk about how do you handle work, how do you handle it when your MS pops up? Are there people they can chat with?
Yes, and there are actually many support groups. So, there are many support groups, and I think this is probably a good time to mention the National MS Society.
When I first was diagnosed, I knew they were out there, and I did a little bit of research on them, but I wasn't fully, I don't think, ready to accept them into my life. But since doing so, I've become very active with them, with volunteering and participating in their different events, and it's been great. They've been very supportive.
In order to keep myself, in tune with what's going on, I do a lot of internet research, the National MS Society webpage, current research that's going on. And we also do things in the MS community together, such as the holiday brunch. We had recently gone to a couples retreat for MS.
When I was first diagnosed, one of my first contacts was the National MS Society here in San Diego, and they were very helpful. I went to a newly diagnosed seminar, learned a lot about MS because I knew nothing of it when I was diagnosed, didn't know what it meant, didn't know how to spell it, didn't know what that meant for my future. So learning about it and meeting other people that were just diagnosed as well was quite helpful.
I'm more the type of person that wants to know, okay, what are you doing to cure this disease? And the skeptic in me is going, you have raised over the last 100 years millions, possibly billions of dollars, and what has come of that? Accelerated Cure Project, ACP. I donate and volunteer for them because they are looking to find a cause for MS, and they're looking at it from a very scientific perspective.
I'm a pretty big fan of the MS Society. I think that they do a lot to help people with MS.
So let's give knowledge about what the different types of MS are and the
Sure.
different subcategories.
Yeah. So the most common type of MS is what we call relapsing MS. And we used to call it relapsing remitting MS, but we don't call it that anymore because the suggestion, at least from that title, was that somehow it all remitted, it all went away. And so we thought that was actually not a good message to send. In fact, it is a relapse or an exacerbation or an attack, and we call that relapsing MS. Oftentimes, much of it goes away, so the remitting part, makes some sense, but it doesn't usually all go away. If it all went away, nobody would worry about having MS. So we say that about 50% of people, after about 10 years, enter into what we call a secondary progressive phase. And during that phase, we tend to have fewer attacks, but a more slowly progressive course. And quite honestly, that's what we're trying to alleviate or eliminate, I should say, with disease-modifying therapy. One of the reasons that we really encourage people to get on therapy early is that so people don't get into that secondary progressive phase. We really feel that it's possible to keep people from entering that secondary progressive phase.
Not just push it back.
Right. And then there's really probably the third most common, and it's not common at all, is something called progressive MS or primary progressive MS. And that's actually fairly rare. Probably doesn't hit more than 10% of people. Seems to come on later in life, seems to be associated with slowly progressive difficulty with walking or gait. And so this is weakness usually of both legs that comes on slowly and progresses very, very slowly. Tends to affect males more than females, so a little bit different from that point of view.
At the very beginning, somebody's sitting across from you in your office, the odds are they have the relapsing.
Exactly, yes.
Do you tell them that?
For them, the news is actually great. For them, we have many treatments, and these are disease-modifying treatments. These are not treatments that just help with the symptoms. These are treatments that really try to change the course of the illness.
I feel the drugs have been very helpful, both with energy, and I'm hearing good things on the MRI reports, like the scars are shrinking, stuff like that. I have an injector. Otherwise, I couldn't do it. I couldn't press the plunger. In fact, when I first started, my wife was giving me the injections because I couldn't sit there with the needle.
In the 7 years now that I've been diagnosed, I've tried only one treatment, and it took me about a year to begin that treatment. I was pretty resistant to drug companies and everything that they made available for people with MS, and I was very just uneducated as far as what's out there. To do my injections, I actually go to the infusion center at the hospital weekly. I'm really not, I don't think at this point, I'm not very comfortable self-injecting. I'm not, because it's a pretty deep shot, so I'm not open to that right now.
I've been on basically every MS therapy, starting with Betaseron, the first that was available, switching to Avonex. I've been on Copaxone. I even did the chemotherapy, the Novantrone, for a couple years. And I'm at a point now in my MS where nothing's really working for me at this time.
So we've talked about disease-altering medications, but they have symptoms. What about the symptom-altering medications?
And one of the things I really like to, spell out to patients is the fact that these symptoms are treatable. So don't just live with them. Don't just endure them. If they're having fatigue, let's talk about it. If they're having depression, let's talk about it. If they're having cognitive problems, there are medications to try. Pain, if they're having pain, there are definitely medications to try. It's interesting, I know that there are a lot of neurologists that don't think that pain is part of MS, and pain is definitely a part of MS.
I feel with my medical needs, the Avonex takes care of the bulk of my MS exacerbation symptoms, but I've also been able to seek help through my neurologist by getting put on drugs such as Neurontin, which has really helped with my numbness and tingliness and just the sensations that I get that can be a little disruptive in my day-to-day life, as well as I've been given Provigil, which is a drug that helps if I'm having days where I just cannot seem to get up the energy to do anything. Then the Provigil, if I take one of those, like, wow, that really gets me going. So yeah, I use that on an as-needed basis, and that seems to have helped.
I've had of the ABC drugs, the Avonex, the Betaseron, and the Copaxone. I've taken those for 11 years, and then I stopped a year ago. The most beneficial, from my perspective, has been physical therapy and simple stretching exercises, like yoga exercises, the physical therapy. That, to me, I wish I had done that from day one. I personally don't think I'd be in this wheelchair if I had, because that's really made a difference.
In our internet-based society, people find alternative approaches, whether it's alternative approach for the disease-altering or alternative approach for the symptoms, from ginkgo onward. Is there a role for some of those, or no?
I think so. I think people need to do what helps them. I mean, quite honestly. And, I like to be honest and tell them we usually don't have placebo-controlled trials that prove that many of these approaches, are helpful.
There are a lot of alternatives out there for individuals with MS. And initially my doctor said, Mark, there's no cure for MS. You have it, deal with it. So, kind of stay away from the snake oil salespeople and stuff and all that. And so what I do is I take a water aerobics class 3 times a week. And the water is at a consistent, I think it's 85 degrees. And it really feels great. It feels good on the, cools the core, and there's no gravity, which is a big benefit, I would have to say, the exercise, definitely, if you can move, to exercise. Use it or lose it is kind of where we're at with that.
I want something that will stop the progression. And I also feel that more needs to be done with things that you can do that are not pharmaceutical answers. I don't think drugs are always the answer.
I think yoga is really good just for your mind and for your body. Stretching is very important. It does help with the balance. Yoga also helps a lot with just relaxation. I do find that eating right and just basically maintaining a healthy lifestyle, whether that's, you know, whatever you can do to exercise-wise. Some people can't. I can't jog, but I can get on a bike. My legs don't go numb on a bike like they do if I walk. So it's just an approach that most people, you know, should take anyway. Just look after yourself and take care of yourself and drink plenty of water and try and get as much sleep as you can, you know, the basic stuff.
If you could look into your crystal ball, what do you see in the future? There's been a huge change in the last 20 years. What's coming in the next 20, 50, 100 years for MS?
Well, I mean, I think that in the future we're probably going to be able to identify people who are at an increased risk for developing MS. And I think that, you know, obviously at that point in time, we're going to want to start therapies earlier. I mean, start therapies even before they begin to develop symptoms, which sounds crazy, but in fact, I think it's going to be before the inflammatory cascade really starts.
Well, I mean, that sounds to me an ounce of prevention.
Yeah,
It still has got to be better than the pound of the cure.
Absolutely. I think if you ask patients what the future should hold, they would say a medication that's not injectable. And really, to that end, we actually may be closer than you may think.
I don't think that they'll cure MS because they don't really know even it has an unknown etiology. They don't know what its cause or what's going on with it. You've got to learn to do the best that you can do for your quality of life with what you got going. And if you wait around for a cure, you're going to be then you're waiting with bated breath for that to happen. And I don't think it's, I don't see it around the corner. But you never know. It could be tomorrow they come up with something.
I think the most important thing is to keep pushing yourself. Keep challenging yourself at whatever level. That challenge may be very basic. How to get up a 6-inch rise in a stair or whatever it may be. How to step into a bathtub.
I feel like I could either be discouraged and depressed and down all the time because I have this disease, or I could take a positive spin on it and say this is what I have and make the best of it. And that's what I do every day, is think, people are a lot worse off than me, and I have it for a reason. And if that's to help other people that are just being diagnosed, then that's why I have it. If it's to make me appreciate my life and my son every day, then that's why I have it, and I wouldn't change it.
You got to take it in small steps, and you just gotta. It's kind of like anything else. If you get too stressed out, you got to just take a couple of deep breaths and just relax.
I think, as with a lot of things, the MS kind of is what you make it. I mean, it really isn't to an extent as well, because I know that it's really out of our control, but I know that perception is everything.
Being with the kids is the greatest positive out of all of this, hanging out with the kids, seeing them growing up, like you would just expect yourself to do as a parent. And that's the most positive thing, I think it's brought my wife and I closer together too.
There's a lot of us out there. And if the more that the public is aware of how we are feeling and how we are adapting to the situation, I think the better for everybody. I would rather not have the MS, but I'm not going to stop living because of it. Or as the saying goes, I have MS, but MS does not have me.